Hey everybody, let's talk today. We've been talking a lot this week about ankle sprains, and things that predispose you to ankle sprains are one of the biggest factors is previous injury. So we've talked about how if you've had an ankle sprain in the past, you really need to make sure that you're rehabbing it well with a therapist, that you're getting everything you need covered. One of the most important things is the peroneal muscles, which we reviewed in our clinical rounds case. That's on YouTube. If you haven't seen it, check it out. It's really awesome. But what I wanted to go through today are some exercises, how you can do your own test of whether or not your peroneal muscles are supporting you well. So one of the things you can do, hopefully you can see my toes pretty well here, is if you go up into a calf raise like this, and you get your heels nice and high, and you find that if you do it in front of a mirror, and you find that you see your heels, so your big toe, in this case, doesn't stay planted, and as you come up, your heels are visible because your big toe is now not driving down, that's often a sign that your peroneus longus muscle is not doing a good job of firing and helping to stabilize that first metatarsal. So things that we can do to improve that are really train it. So one of the best ways to train it is to put yourself in that position. Make sure your big toe is pressing down. There's a little hack you can do if you're having a hard time telling if your big toe is pressing down. Take a quarter, put the quarter on the ground, stand with this part of your ball of your toe on the quarter, and then drive that quarter down as you come up. Do it in front of a mirror so you can see, is my heels visible? If my heel's visible, then you're supinating too much and you're not recruiting that peroneus longus again. So do it in a way where you cannot see your heels. Start with just these, up, down, good calcaneal position, big toe driving straight down. When that gets easy, you can turn that into a now hold that as you squat. So we're gonna squat here. We're gonna make sure that our calcaneus stays nice and high. We're gonna make sure that our big toe stays down, and then we're gonna nice, slow and controlled come back up. So you're gonna work on that for a couple weeks. As that gets better, you're gonna do the same thing. You're gonna come up, you're gonna drive big toe down, you're gonna keep calcaneus high, and then you can add some rotational patterns with your arms, eyes and arms. If you bring your eyes into it, change your gaze, it'll make it even harder. You can see me working harder here. Go chopping patterns as we call them. I'm working hard on this right foot. Chopping patterns that way. Woo, that sounds hard for me. And then down, and then come back up, and then bring everything back down. So those are 3 progressions that you can do to train your peroneus longus in a functional way that will help you hopefully prevent any future ankle injuries. If you have a lot of incidents of ankle injuries, please see a therapist or someone that can work with you on advancements of these exercises, but otherwise give them a try. Let me know what you think.